The Grants Management Unit is in charge of managing the principal recipient role of TASO, Principal Recipient for Global Fund. As a country, if you look at the National Development Plan, the malaria reduction strategy, and all the other health targets that we intend to achieve, this dashboard helps us achieve our part and in doing so contribute to the national achievement.
The dashboard has certainly benefited us as a principal recipient in so many ways. It's visual. You have three colors. It's that simple. You have three colors that will indicate a fine state. If a grant is performing well, you have the yellow color that will show a warning sign where you're not performing so well, and where you're really underperforming, you get a red signal. So it's really visually stimulating and very easy to interpret.
The benefits of using the PR Management Dashboard is that, one, it saves time. Just by looking at it, I know where to focus my attention. Secondly, in developing the dashboard, it gets everyone to participate. So you get to know more than just your section, and this helps us to have officers that know the whole grant. And third, it helps to also communicate with stakeholders on the outside. The CCM will easily see where the problem is. The CCM will easily see how the grant is doing and where they need to come in to support.
We did notice that we were not performing as well as we had wanted on the distribution of the nets through the antenatal clinics to the children under 5, and were able to ask the questions to understand what were the challenges for the sub-recipients and what were the challenges for the principal recipients. The Uganda CCM was able to look at how best can the CCM support this process to unblock the problems. Is it at the warehouse, or is it at moving these nets from the warehouse to these services, the clinics where the pregnant women go, or the immunization clinics, or is it where is the problem? We are able to work as a country.
Once every SR was able to see their performance flashed before everyone. At first they were skeptical, they were scared. They thought it was more competitive probably. But then as we went on discussing, they realized that then it's easier for them to seek guidance from the fellow sub-recipient on how they can improve their performance. So once we had these kinds of discussions during the performance review meetings, they realized it's easier now for them to interact with each other to improve the performance of the grant.
Looking at, for example, the mosquito nets, the pregnant woman out there, the child that's getting immunized. By being able to get these services down to them very fast and efficiently, we not only save time but also save money. Just by looking at the dashboard, know how many people have benefited from this service, and we try to get to those that may not have received it.
We have data on a quarterly basis for finance, for programmatic indicators, for supply management and procurement, and also data regarding the general management of the grant. And we can present all this on the click of a button or on one display. It's amazing what the tool can actually do, and the kind of information it urges you to keep collecting from different aspects of your grant.
Whether it's to do with strategies, whether it's to do with the policy, whether it's to do with unbottling or tackling the obstacles in implementation, having seen the benefits that the dashboard brings to one of the principal recipients, we are only hoping that we are able to have the benefits from the other principal recipients in the public sector to ensure that we bring these across to cover the whole country in terms of the coverage that both principal recipients are achieving, and be able to strengthen our oversight, management and implementation of the Global Fund grants. And with this, we are definitely able to reduce the impact of HIV, of TB and malaria in Uganda.